Hello everyone who's watching this video. My name is Fuentes and today I'm doing a teaching video presentation in the topic wound care for people with diabetes. I decided to choose this topic because of my preceptor, Lisa Maldonado, who told me that this is a really important topic that needs to be addressed because there are many patients going home with diabetes and wound complications because of this disease. So I will be covering what is a diabetic foot ulcer and how can we prevent it, the importance of wound care at home, and some resources that we can consult for these wound problems. My target audience would be nurses, patients, and all the staff members that are involved in the patient's care. So let's start talking about what is a diabetic foot ulcer. So according to the World Health Organization, the foot of a diabetic that has a potential risk of pathologic consequences including infection, ulceration, or destruction of the deep tissues associated with neurological abnormalities. Now let's talk about some signs and symptoms of diabetic wound. The first one is going to be chronic pain or no pain at all, inflammation and redness, pus drainage, bad odor, dead tissue around the wound, numbness and dullness, fever, and chills. A diabetic foot ulcer is an open sore or wound that occurs in approximately 15% of patients with diabetes and is commonly located on the bottom of the foot. Of those who develop a foot ulcer, 6% will be hospitalized due to the infection or other ulcer-related complications. The best way to treat a diabetic foot ulcer is to prevent its development in the first place. Recommended guidelines include seeing a pediatrist on a regular basis. Your pediatrist can determine if you are at high risk for developing a foot ulcer and implement strategies to their prevention. The key to successful wound healing is regular pediatric medical care to ensure the following gold standard of care: lowering blood sugar, appropriate debridement of wounds, treating any infection, reducing friction and pressure, and restoring adequate blood flow. Now let's talk about some risk factors for wound in diabetic patients. Patients most likely to have a foot ulcer include long-standing diabetes, insulin-dependent, and smokers. In addition, some other people that can be at high risk for foot ulcer is people who have neuropathy, poor circulation, a foot deformity, wear inappropriate shoes, uncontrolled blood sugar, or a history of previous foot ulceration. Wounds need to be treated as soon as possible to avoid serious complications. Some complications include foot injury, infections, ulcers, damage to nerves and bone, and poor blood flow. Some recommendations that as nurses we need to tell our patients is we need to tell them that they should look for the wound location, the wound size and depth, wound appearance, to assess it for COCA, which is color, odor, consistency, and amount, drains, odor of the wound, surrounding skin, if the skin is intact, or redness, or if they have any pain. What is the importance of wound care at home? Well, although it is not always recognized as a present healthcare problem, wounds are a common, complex, and costly condition. Treating wounds is growing rapidly due to the increasing healthcare costs, an aging population, and a sharp rise in the incidence of diabetes and obesity worldwide. Up to 65% of patients affected by chronic wounds report experiencing decreasing quality of life, restricted mobility, anxiety, depression, and severe and continuous pain. Appropriate clinical management of wounds requires a team-based, coordinated approach to diagnosis, treatment, and patient education. A case manager assesses each patient's home care needs, including for wound care, and if they have any need of care, they can help them out with home health. Home care is provided on either a short or long stay basis. The specific services and the intensity of services provided vary dependent on client need, but may consist of homemaking personal support such as assistance with bathing and health professional visits such as nursing or physiotherapy. Although this is not a presentation to talk about each step in the process of wound care, I'm just going to go over some important topics that we need to know. If there's necrotic tissue present, you need to consult the wound care specialist. If there's deep ulcers, they may require 3 layers of dressings. The first one is a contact layer touching the wound bed. The second one is a loose fill layer. The third one is the cover layer, which holds the dressing in place. There are compression dressings that are used for treating non-infected venous ulcers, usually on an outpatient basis. Competence of the healthcare professionals and continuity of care are crucial because they can either enhance or worsen the wound care. The best wound care pathway for patients with diabetes foot ulcers is dependent on a combination of competence and professional skills in wound management and continuity of care. Some other continuing care network of home health agencies include Tender Care Home Health and Encompass Home Health. As you can see in the screen, there are many other agencies that you can consult. So now let's talk about some resources for wound care. So the KCI is a global advanced wound care company committed to developing innovative healing solutions for customers and patients. This company offers negative pressure wound therapy systems and epidermal harvesting system. Thank you so much for taking the time to watch the whole video.